Before I get started, I wanted to give a quick heads up. In this episode, I'm talking about suicide and suicide prevention. I know that can feel heavy or triggering, so please take care of yourself if you choose to listen. And if at any point you want to pause or skip this one, that's completely okay. And if someone you love is in a crisis, you can call 988 in the United States to reach the Suicide and Crisis Lifeline, or you can text 988 or use the emergency resources available where you live. Every year, it's as if an entire hospital ward filled with doctors, nurses, and colleagues vanishes without a trace, lost to suicide. Behind each of those lives is a story, a family, a friend, a community forever changed. I'm inspired by the Lorna Breen Heroes Foundation to talk today about suicide prevention for physician and healthcare workers. Today, you'll hear about Dr. Breen's story to shine a light on awareness and hope, because noticing the signs, connecting with someone in need, and advocating for mental health can literally save life. My hope is that this episode is a reminder that awareness matters and action matters and connection matters. Together, we can turn awareness into action and despair into hope. You can find the full transcript and bonus resources for physician moms at inspiredmommds.com/78. Welcome. You're listening to the Inspired Mom MDs podcast. I'm your host, Dr. Cindy Van Praag. I help physician moms reconnect with what truly matters by taking back control of their time and energy so they can thrive at work and at home. In honor of Suicide Prevention Month, which is September, today's episode is dedicated to suicide prevention for physicians and healthcare workers. This conversation is both urgent and hopeful. Suicide Prevention Month brings up so many emotions: a sense of loss for friends and colleagues who died by suicide, relief for those who did get help when they needed it, and urgency to spread awareness to those struggling right now, today. My message, to be clear, is one of hope. With the power of community, the impact of one's individual action, and the reach of awareness, people can get help. I don't presume to truly know what someone is struggling feels deep in their core, but I do know the perspective as a mother, as a friend, and as a physician all too well. I do want to bring awareness to the scope of this illness nationally, especially for healthcare providers, and most concerningly for female health providers. Now, the statistics around suicide are sobering and demand our attention. In the United States, according to the CDC, in 2022, suicide was the 11th leading cause of death overall in the United States, claiming the lives of over 49,400 people in 1 year. This is hard to comprehend for me, so I looked up the stadium capacity for the arena in Amsterdam, Netherlands. And I looked that one up because I was just there last year for a Taylor Swift concert. It was on July 4th. And the way she had the stage set up off to one side, the statistics are that the arena could hold about 50,000 people. And it was a sold-out show. It's hard for me to imagine all of those people lost to suicide over the course of a year. Now, broken down by age group, suicide rises from 11th place to 2nd, 3rd, and 4th leading cause of death, depending on the age range. And when you break down these overarching statistics by gender, you find that men have an age-adjusted suicide rate 4 times higher than women in the United States. But what about the numbers for men and women in medicine? They are strikingly different. Female doctors have a 53% higher suicide rate compared to women in the general population. In contrast, male doctors actually have a lower rate compared to male non-physicians. Female nurses are 8.5 times more likely to die by suicide than the general female population, too. I'm talking about U.S. statistics because women in healthcare are more likely to die by suicide here in the U.S. than other nations, although attention, of course, is warranted in other countries. I do have an article from the British Medical Journal in the footnotes. Now, the numbers can shock us, but behind every statistic is a colleague and a friend and a human being, which is why it's so important to not just understand the data, but to recognize the warning signs in the people around us. So how do you notice when someone around you might be struggling? Sometimes the signs come out of nowhere. You didn't expect them. Dr. Lorna Breen was a dedicated emergency physician, a sister, a daughter, a friend, and she was the cool aunt to 8 nieces and nephews. She spent her career caring for patients at New York Presbyterian Hospital in Manhattan and ultimately served as the director of the emergency room at Allen Hospital. In the spring of 2020, during the peak of the COVID-19 crisis, Lorna worked grueling 12-hour shifts treating incredibly sick patients, and she had severely limited supplies and limited staff. She would stay beyond her shift to help her coworkers, which they did too, of course. Extreme exhaustion and emotional strain escalated to the point where she couldn't even stand up. But she feared seeking help because of potential stigma and professional consequences. She feared for her job. For those around in healthcare, medical licensing boards throughout the country require disclosure by the applicant of current or past mental health care, and at any level. And hospitals also require disclosure for credentialing, and seeking mental health care is considered a sign of weakness among many medical professionals. So Dr. Breen had no prior medical issues. She was smart, funny, sarcastic, yet she died by suicide on April 26, 2020. Her story is a stark reminder that sometimes despite outward appearances, those struggling may go unnoticed, even among colleagues, friends, and loved ones. Other times, the warning signs are visible but maybe easily brushed off or rationalized. One way to approach how to look for these signs in other people is by using an acronym called HEART, like your beating heart. It's from the Physicians Foundation. They have an initiative to help prevent physician suicide by recognizing warning signs. And these are like vital signs. And of course, this acronym applies to everybody, to nurses and to all healthcare professionals who are struggling. So it is called HEART. Each letter is a vital sign. H is for health, increased use of medications or alcohol or drugs or talking about wanting to hurt themselves. E is for emotions, experiencing extreme mood swings, feeling hopeless or having no purpose. A is for attitude, being negative about professional and personal life or having inappropriate outbursts of anger or sadness. R is for relationships, withdrawing or isolating themselves from family, friends, and coworkers, or talking about being a burden to other people. T in heart is for temperament, acting anxious or agitated or behaving recklessly, or being uncomfortable or tired or in unbearable pain. Some of these are subtle at first or hard to recognize, but some are really obvious, right? Maybe you've noticed a coworker who's withdrawing or having a change in their demeanor or are saying they're struggling. The purpose of memorizing a simple acronym like HEART is to help us be the ones who notice and take action. So what do you say and where do you go for resources to take action? I found the more I talk about suicide with people, the more comfortable I get, which is good, which makes me talk more. And I'll start with questions like, I've noticed you've seemed different lately. Is everything okay? Or if they do open up, I might say, you're not alone. I'm here for you. Let's talk about this. Or I'll ask the direct questions if needed too, like, are you thinking of hurting yourself or are you having suicidal thoughts? A lot of physicians and healthcare workers are really hesitant to seek help. This is a huge issue, so gently remind the person of some confidential resources. Top numbers for immediate help would include the National Suicide and Crisis Lifeline, where you text or dial 988 in the United States, and the Physician Support Line. This is for the United States. You dial 888-409-0141. That's 888-409-0141 in the U.S. This line is staffed by psychiatrists, and they are helping physicians and medical students. There are several more resources. I put them all in the show notes or footer below. Please check those out. Please check out your local resources. So it can feel uncomfortable to be speaking to a friend or patient with direct questions, but it will get easier. Asking a question out of concern and support will help, and it won't drive the person to act on their thoughts. Now, knowing what to say or where to find help is powerful, but your impact doesn't have to stop there. Once comfortable having these conversations and connecting people with support, you may want to take the next step and become advocates for suicide prevention and healthcare worker wellness. I'm honored to serve as an ambassador for the Dr. Lorna Breen Heroes Foundation, an organization born from the tragic story of Dr. Lorna Breen that I just discussed. The foundation fights for the professional well-being and mental health of healthcare workers through several initiatives. They have more successes than I can list here today, but here's one. You know those intrusive mental health questions on licensing applications I just mentioned? The foundation fights to have those removed. And as of May 22nd, 2025, there's 1 dental board, 37 medical licensure boards, 5 nursing boards, and 7 pharmacy boards that have verified their licensing applications do not include these questions. This alone affects nearly 1.4 million licensed healthcare workers. What an impact. The foundation has multiple ways you can take action from the organizational level to the individual level, so I recommend you check out their website to get started. There are other forms of advocacy too, right? It can be as simple as posting about mental health awareness. It can be encouraging a friend to use mental health resources, or it can be supporting local programs that provide healthcare worker mental support. For example, the Suicide Prevention Resource Center has a PDF full of ideas to take action this month and beyond to help prevent suicide. There's a link in the footer below. Please check it out. And in that link, you'll find the PDF. And in the PDF, you'll find more links to more ways that you can help out. Just remember, every small action that you make amplifies the message that seeking help is a sign of strength and not weakness, and that no one in medicine should face these struggles alone. Thank you for joining me through this episode today on suicide prevention for physicians and healthcare workers. I discussed the scope of the problem with current suicide statistics and highlighted the importance of staying alert to the warning signs of suicide in colleagues with specifically the HEART acronym. If you or someone you know is struggling, please don't wait. Please reach out. You can always call or text the National Suicide and Crisis Lifeline at 988. That's in the United States. And you can check out multiple other resources in the show notes below or on my website, inspiredmommds.com/78. You can also check out resources in your area if you're not in the United States. Today, I aim to bring awareness and highlight resources and foster hope. Suicide Prevention Month is a sacred reminder of the colleagues that we've lost and the family and friends that carry that grief. But awareness matters all year long. If you're listening, take heart. Your voice and your questions and your reach could save at least one person's life. Thank you to the Dr. Lorna Breen Heroes Foundation for leading courageous conversations in healthcare. You inspire hope and action and healing. Don't forget to join me next week for another dose of support and inspiration. And until then, take care of yourselves and take care of those who matter most. It's time to take control and thrive. Thank you for tuning in today to the Inspired Mom MDs podcast. If this episode resonates with you, please share with a friend who may benefit too. And I humbly ask you to please leave a review so other Dr. Moms can find me too. And just a quick reminder, this podcast is for informational and educational purposes only and isn't a substitute for medical advice or care. I'm a board-certified physician, but this content isn't connected to my clinical practice and no doctor-patient relationship is formed here. Please always talk to your own health professional about any mental or physical health concerns. And as always, take what helps and leave the rest. Please see inspiredmommds.com for full disclaimer.